This day was anything but normal for juniors and seniors of Rockville High.
It's a short ride into Hartford, and then you'll be in the trauma center.
They're seeing what it's like when classmates and friends are injured and killed in car crashes.
A lot of kids, when they walk out of here, they talk about it pretty much all day long.
School administrators hope they do more than talk.
We're really trying to raise the awareness so that our students will make good, positive choices and not repeat this performance.
Parents who are living with the loss of a child also help to drive home the need for smart teen drivers. There appear to be some breakthroughs.
Even though, like, some of them don't seem like it, they can feel it.
You saw kids crying, I mean, right there you have an effect on them, so I definitely think that a lot of people will be thinking twice.
It'll teach kids to actually listen to their parents and to make smart decisions.
Authorities with the U.S. Department of Transportation say it's a lesson worth learning.
In terms of traffic safety, teens are the group that are most likely to die in traffic crashes. They have a rate which is about twice the national average.
A Jefferson teen was killed in a car accident.
A teenager who killed 2 friends in a car crash.
One teenager is dead and 2 others seriously hurt in a car accident.
The distraction of friends, the use of cell phones, text messaging, alcohol, speeding, and not using seatbelts are factors in car crashes that kill more than 6,000 teens every year.
The number of teenagers who died in car crashes has gone down dramatically, but I think there's still room for improvement because car crashes continue to be the leading cause of death.
Most thought it wouldn't happen to them.
Teenagers are famous for that, the not me syndrome. And part of what we need to help them understand is that not me syndrome really has to do with what's going on in their brain.
Dr. David Walsh of the University of Minnesota says new research shows that while a teenager's brain has reached its full size, it's far from being completely developed. And he says that it is that lack of development that interferes with their ability to assess risks, manage impulses, and understand their consequences.
If they want to be smart and if they want to be safe, they have to be aware of that and compensate for it.
To help teens become smart drivers, the ABCs of injury prevention are being used to develop and evaluate programs designed by community leaders and top physicians across the country. They are a part of the Injury Free Coalition for Kids, a hospital-based community-oriented organization with 44 sites in 40 cities.
The challenges of teen driving and these issues are so diverse that it's good that we have so many perspectives and so much experience in the different areas.
National meetings and summits like this all-state-sponsored effort in Arkansas offer the opportunity to examine those challenges and best practices used in other cities.
It's a public health response. It's being able to take what we know, that we have seen, that we have observed, that we have tested, that we know works, and then moving it out into the community.
In Minneapolis, teens are teaching teens the importance of smart teen driving, using messages they developed in a program called the Seatbelt Challenge. In Rochester, New York, the glitz and glamour of vintage cars is being used to teach teens about smart driving and the perils of drunk driving.
Turn left.
In Connecticut, driving simulators are being evaluated to see how effective they are when it comes to developing smart teen drivers.
We take care of a lot of rare diseases as pediatric surgeons, but by and large, the greatest killer we have are cars.
Also in that city, doctors are using meetings called Grand Rounds to talk to other doctors about the issue and to teach them how to help save lives by having their patients and their parents sign contracts encouraging smart teen driving. In Arkansas, you can find information about smart teen driving in adolescent clinics, and the coalition there is evaluating a curriculum to see if it makes a difference in the use of parent-teen contracts.
Then what's your next step? Make sure my mirror's straight.
At least one parent says it's helpful.
What happened was it allowed me to set the ground rules. He knew what the consequences would be, and when he broke them, which he did, he suffered the consequences of breaking the rules.
Now when I'm with my brothers, they ask me to do a lot of things like go a little faster. I'm trying to get to school, and I'm like, no, I'm trying to take my time.
In Connecticut, the coalition was on the task force that led to the governor signing into law some of the country's toughest laws affecting teen driving.
It was really an extraordinary opportunity for us to take our expertise in the epidemiology of pediatric trauma and injury with respect to teen driving and make some meaningful recommendations to the types of changes that would make sense to enact.
Teen drivers in Connecticut can no longer have passengers other than their parents during the first year they drive. When they are able to have passengers, there are limits on the number of people, a curfew that limits hours, and there are random checkpoints. Violators can have their license suspended on the spot.
That means you can't get the ticket and not tell your mom or dad about it because you can't explain why the car is not in the driveway.
Little Rock sees the need for tougher laws for new drivers as well.
What we hope here is to build the capacity to encourage GDL, graduated driver's licensing, within the medical settings, within families, and the policy environment.
Change is on the way.
Before I joined the coalition, I'd sent in some defensive driving class to keep it off the record. Well, now I enforce it. For reckless driving, the fine is $350 to $500, and it's an automatic 5 days in jail. And I sentence them to jail. I suspend the jail sentence and require them to do community service in lieu of that.
They help make a difference in lawmakers.
Basically, you can say, I guess that I've matured as a legislator, and I want to see lives saved, because I know that a better graduated driver's license law in Arkansas will save lives.
Results that make a difference are nothing new to the coalition and its executive director and founder.
Besides just the data, which determines what we're working on, we can evaluate the effectiveness of our programs. And this is hugely important because certainly we don't want to waste time doing things that don't make a difference.
Supporters say funding provided to the coalition is money well spent.
Very few organizations can build community coalitions like the injury-free folks have. And at the end of the day, what you really need is a community-wide response to an issue.
This is a problem that's made up of tragedies in every single community across the nation. And so the solution has to be local.
People who know about these tragedies firsthand say there is nothing more important than making these efforts work.
We need to start paying attention to these issues. We need to educate the public. Parents need to be aware of the risks, and we need to take action to save our teens.
We're doing our best to help. To learn more about the coalition and to help programs that help to keep teens alive, go to our website, www.injuryfree.org.